Hi everyone. Today we have a very special guest with us whose name is Dr. Mandar. Dr. Mandar is a pediatric physiotherapist working as a pediatric physiotherapist in KIMS College, Karad, as well as he is the head of the department of pediatric physiotherapy. I highly welcome you, Dr. Mandar.
Thank you. Thank you so much.
That's great. So, Dr. Mandar, can you please tell us a little bit about yourself and how you got interested into pediatric physiotherapy?
Actually, when I joined physiotherapy, I was absolutely unaware what exactly physiotherapy was or is. And it was just like the opportunity was available. There were rounds going on and the opportunity was available. It was in my town, so I joined. I was only happy because I will be allowed to wear a white coat. That was the thing which I always wanted to. And I joined physiotherapy. And before that, I didn't have a single clue what exactly is the physiotherapy. But then slowly, as the time passed by, and then I realized, okay, what exactly I'm supposed to do, where I'm supposed to stand, what is my job as a physiotherapist, and then slowly it started making me realize that, okay, what exactly is the physiotherapy. And during my second and third year, when I was posted in pediatrics, we had one particular child who was with Down syndrome. His mother used to come, and to my teachers, Dr. Sharma, Jyoti, uh, and I would definitely mention Dr. Sneha, with whom I had observed how they are working with these kids and how they make magic with them. And I thought, yes, I also want to be such a magician and I want to be kids for me. And then I decided in my third year that okay, I'm going to join pediatric physiotherapy and I'm going to work with them. And here I am. Now I'm an HOD in Krishna for pediatric physiotherapy department and I'm working over here since last 5 years.
That's great. That's great. So it's really good to know that from second year itself and third year itself you got to know that you got interested into pediatric physiotherapy and you got such a good mentors and you still remember your teacher's name. That's really good. We all need such mentors in our life. That's great, sir. So moving forward with our another question. So, sir, what exactly is pediatric physiotherapy and how it differs from other physiotherapy fields?
See, in simple words, I would say pediatric physiotherapy is working with the kids who need therapy. That is the one thing. And secondly, if you compare an adult physiotherapy and pediatric physiotherapy, the main thing is you need to be very patient and all your ego or your knowledge doesn't work here.
Okay.
You cannot use a particular formula in pediatric physiotherapy. Like in ortho, like in neuro, you have a specific 10 RM, you have a specific protocol for 1 day, 2 day, third day. It doesn't work in pediatrics, definitely no. इथे तुम्हाला प्रत्येका मुलाच्या इच्छेप्रमाणे जावं लागतं. आज जर एक बेबी म्हणाला की नाही की मला आज नाही एक्सरसाइज करायची मला खेळायचं, you have to obey the child's needs. You have to obey his command. Here, the child is a boss. Whereas in other departments, in other physiotherapy, you are the boss, but here a child is a boss. You have to pretend that the child is a boss. And secondly, in pediatric physiotherapy, it's always fun when you work with the kids.
That's great.
You need to use a lot of your imagination, a lot of your ideation, a lot of activity and creativity when you work with kids. इथे तुम्हाला एका पर्टिक्युलर फॉर्मॅटमध्ये कधीच बसता येत नाही. सगळं तुम्हाला तुमच्या इमॅजिनेशन जावं लागतं, तुम्हाला गोष्टी सांगाव्या लागतात, तुम्हाला गाणी म्हणावी लागतात, तुम्हाला नाचावं लागतं, तुम्हाला उड्या माराव्या लागतात. तरच तुम्ही तुमच्या पेशंटला हॅपी करू शकता आणि तुमच्याकडे तुमचा पेशंट परत येऊ शकतो. तसं अडल्ट मध्ये नाही होत. अडल्ट मध्ये तुम्हाला जे प्रोटोकॉल असतो तुम्हाला करावा लागतो आणि त्याच्यातून तुम्हाला रिझल्ट मिळतात. सो दिस इज अ बिग huge difference between regular physiotherapy and pediatric physiotherapy.
दॅट्स ग्रेट. सो आपण जसं म्हणतो की लहान मुलं ऑलरेडी एवढे क्यूट असतात. त्या क्यूट मुलांसोबत खेळून आणि त्यांचे थेरपी करून प्लस त्यांना रिझल्ट देणं, दॅट्स अ प्रिटी बिग टास्क अँड अ बिग चॅलेंज अँड यू हॅव डन दॅट. And we are really happy to see you at this stage. So as in our previous conversation तुम्ही बोललात की तुम्ही किम्स कॉलेजमध्ये HOD आहात पीडियाट्रिक डिपार्टमेंटमध्ये. तर तुमचं एज्युकेशनमध्ये काय रोल
हो.
आहे त्याबद्दल तुम्ही काय सांगू शकाल?
एज्युकेशनमध्ये स्टुडंटच्या बाबतीत मला खूप पर्टिक्युलर राहावं लागतं, कारण थर्ड इयर पासून पोस्टिंग चालू होतात आमच्याकडे कॉलेजमध्ये. आणि मुलं जेव्हा थर्ड इयरची किंवा फायनल इयरची मुलं जेव्हा आमच्याकडे, स्पेसिफिकली पहिल्यांदा थर्ड इयरची मुलं जेव्हा येतात, तेव्हा त्यांनी जस्ट थेरॉटिकल नॉलेज घेतलेलं असतं पीडियाट्रिक्सच्या बाबतीत, पीडियाट्रिक फिजिओथेरपीच्या बाबतीत. आणि जेव्हा ते डिपार्टमेंटमध्ये येतात तेव्हा मुलांचं रडणं बघून किंवा ना त्यांचं ओरडणं, त्यांची शी शू कधी कधी करतात, कधी उलटी करतात होतं, म्हणजे इट्स व्हेरी कॉमन इन पीडियाट्रिक डिपार्टमेंट. तर अशा वेळेला त्यांना थोडस ते स्टेप बॅक करतात की नाही, आय डोंट थिंक सो आय कॅन हँडल दिस. तर अशा वेळेला मला त्यांना पहिल्यांदा त्यांच्या पोस्टिंगच्या डे 1 डे 2 मध्ये त्यांना खूप समजावून सांगावं लागतं की this is part and parcel of being a pediatric therapist, and you have to learn how to tackle this.
Correct.
It is not bad, and the child is going to make tantrums only and only if you irritate him or her.
Correct.
If you're going to be playful, if you're going to go with the flow with the child, then the child will reject you.
Correct.
आणि सेकंडली असं असतं की जेव्हा तुम्ही मुलांच्या सोबत काम करता त्यावेळेला तुम्ही जितके जास्त त्यांच्या कला घेता तेव्हा तुम्हाला जास्त चांगले रिझल्ट मिळतात. तर मला हे त्यांना समजावून सांगावं लागतं. एक पर्टिक्युलर ढाच्यामध्ये तुम्ही बसून मुलांच्या सोबत काम नाही करू शकत. आणि बऱ्याच मुलांनी हे ऐकून त्याच्यात ते इम्प्लिमेंट केलं आणि त्याचा त्यांना फायदा झाला. आता माझ्या डिपार्टमेंटमध्ये असे काही काही पर्टिक्युलर मुलं आहेत की त्यांना ते स्पेसिफिक दादा किंवा ते स्पेसिफिक दिदीच लागते कारण त्यांच्यासोबत मजा येते. आणि काही माझे स्टुडंट्स पण असे डिपार्टमेंटमध्ये येऊन बसतात की नाही सर, आम्हाला तुमच्या डिपार्टमेंटमध्ये येऊन बसायला आवडतं कारण तिथं मुलांच्या सोबत आपल्या खेळायला मजा येते. सो इट्स 1-to-1 सेशन अँड इट इज लाईक दोन्ही बाजून असतं, चाइल्ड कडून पण आणि थेरपिस्ट कडून पण. एकदा ते खेळीमेळीचं वातावरण असेल तर खूप छान थेरपी होते आणि मजा येते. आणि मुलांना एज्युकेशन मध्ये मला हेच शिकवणं जास्त इम्पॉर्टंट वाटतं. आय वर्क ॲज अ पीडियाट्रिक फिजिओथेरपिस्ट अँड व्हेन आय टीच pediatric physiotherapy to my students.
That's really great, sir. That's really great. So just moving forward to our another question. तर सर जसं आपण म्हणतो की पीडियाट्रिक फिजिओथेरपीमध्ये आपण लहान मुलांना करतो, आपण फिजिओथेरपी प्रोव्हाइड करतो. तर तुम्ही पॅरेंट्सला कसं मॅनेज करता त्या गोष्टींमध्ये? जे पॅरेंट्स असतात किंवा केअर गिव्हर्स असतात तर त्यांना कसं तुम्ही मॅनेज करता? जसं आता तुमच्याकडे काही मुलं ट्रीटमेंटसाठी येतात, ट्रीटमेंट करून घरी गेल्यानंतर मग तुम्ही कसे त्यांचे थेरपी गोल्स कसे मेट झाले पाहिजे, तुम्ही जे डिसाईड केलेले असतात ते कसं फॉलोअप घेतलं पाहिजे, ते कसं तुम्ही मॅनेज करता मग?
थँक्यू सो मच हा प्रश्न विचारल्याबद्दल, कारण हे खूप महत्वाचं आहे. सी, द चाइल्ड थेरपी goes on maximum to maximum 45 minutes, not more than that. After that, remaining time of a whole 24 hours, the child is going to be at home with the parents. So, pediatric physiotherapy is like a triangle where a therapist, a child, and a child's parents, we need to work together. Okay, so whenever a child goes out from the department, once our therapy is done, what we do is we give them a house activity.
Okay.
We don't give them a protocol. We never give them a protocol because protocol doesn't work in with kids, as I said earlier. Pediatric मध्ये तुम्ही कुठल्याही मुलाला फ्लेक्शन एक्सटेन्शन करा, PA स्ट्रेचिंग करा, पॅरेंट्सला सांगायचं पॅसिव्हली स्ट्रेचिंग करा, त्या गोष्टींचा काही होत नाही आणि पॅरेंट्स सुद्धा ते करायचं कधीतरी टाळतात. हा म्हणजे आमचा अनुभव आहे. तर व्हॉट वी डू इज वी गिव्ह देम अन ऍक्टिव्हिटी लाईक ओके फाईन, इफ यू इम्प्रूव्ह द बॅलन्स, सो why don't you ask your child to go and get the water without spilling a glass full, or we ask them to find out where there's or the height of, or get a specific color pack of So this way, if we do it, the activity will work as an exercise for them, and it works wonders with them. Rather than giving them like, okay fine, उठा बशा काढा आणि चाला, हे सांगण्यात काही अर्थ नसतो. ह्या गोष्टी सांगितल्या की नक्की होतात. आणि या अशा प्रोग्राम मधूनच आम्ही पॅरेंट्सना एज्युकेशन देतो की ओके ठीक आहे, हा प्रोग्राम तुम्हाला डेफिनेटली पुढच्या सेशन मध्ये फायदा होईल असं.
Great, sir, great. That's really beautiful piece of information you have shared, sir. So just moving forward to another question, तुम्ही तुमच्या करिअरमध्ये अशी कोणती एक पर्टिक्युलरली केस शेअर करू शकता का? म्हणजे यू फेल्ट दॅट केस वॉज डिफिकल्ट फॉर यू, बट यू डिड युअर बेस्ट अँड द चाइल्ड वेंट हॅपीली फ्रॉम द हॉस्पिटल or your clinic. Can you share some details of that case, basically?
Well, in my experience, it's been like 10, 12 years now, and I'm working in a pediatric therapy. There are many cases which I have seen, came across, but one particular case in Karad which we have treated was with GBS. The child was 10 years old, and the child, when we got reference for the child, he was in ICU, and a complete dead vegetable sort of a situation was there. There was no tone. The child was on ventilator, and there was a lot of chest complications. There was absolutely no response from the child, and we started with the coma stimulation. We started with movement and everything. And the chest physiotherapy, positioning, everything we did, and slowly the child started gaining the power back, consciousness back, and after three to 3.5 years, 3.5 months, sorry, we could see him walking, we could see him standing, and by the end of 4th month, the child started walking, running, doing the activity very well. There was a residual effect also for GBS, where he could not heel strike. There was a problem with that, but his upper limb was absolutely fine. He started eating himself, he started doing all the activity by himself. The only thing was with the heel strike, which was the only thing, but the parents were so happy with our therapy. The child started going back to school, and it worked very well.
That's really great, sir. तुम्ही एका पेशंटला GBS केस जी होती, ज्यांना तुम्ही बेडवरतून जसं तुम्ही बोलात मसल टोन वगैरे काही नव्हतं, त्यांना तुम्ही चालवलं, आणि दॅट मदर वॉज सो हॅपी आफ्टर सीइंग दॅट्स द रिअल जॉय ऑफ अ फिजिओथेरपिस्ट. एका पेशंटमध्ये इतकी इम्प्रूव्हमेंट बघून त्याला चालवणं, स्वतःच्या पायावरती चालवणं, दॅट इज वन ऑफ द ग्रेट पार्ट इन मेडिकल सायन्सेस, आय फील. म्हणजे एका पेशंटसाठी आपण एवढं करतो, आपण मेहनत फुल टाकतो, आणि त्यानंतर वी गेट अ पॉझिटिव्ह रिझल्ट, अँड द ब्लेसिंग्स विच वी गेट फ्रॉम पॅरेंट्स इज कम्प्लिटली डिफरंट. सो आपण जसं आता पॅरेंट्स बद्दल बोललो सर, तर
इट्स लाईक अ डबल थिंग.
येस,
actually it's like a double thing. You don't just get a praise from the child, you also get a praise from the parents, the relatives, and everybody. So it's like many layered blessing you gain when you are working in pediatrics. That's the one plus point which is better than other doubts.
Okay, that's great. So as we mentioned about parents, sir, that what kind of difficulties do you face when you talk to parents of such kids who actually require physiotherapy? Like when you talk to parents of cerebral palsy or autism kids, so what kind of difficulties you face to explain them, and how do you convince them to continue for therapy services?
That is the one big thing actually in pediatrics, because what happens is in most of the areas where I work, I have been to North, and I have been to Gujarat, I have been to Nashik area. I was working in many places around. The one thing which I have observed and I could find is that father is the one thing who little bit hesitates to come to the clinic and मी पैसे देतोय आणि माझं काम झालं, अशा पद्धतीचा एक फादरचा रोल असतो ह्याच्यामध्ये. Whereas mothers are so concerned and they are under so much pressure की माझ्या बेबीला हा प्रॉब्लेम झाला, मग ही माझी चूक आहे आणि माझ्यामुळे हे सगळं होतंय.
ओके,
असा एक सॉर्ट ऑफ त्यांच्यामध्ये गिल्ट असतो. तर अशा वेळेला आम्हाला पॅरेंट्सना दोघांनाही घेऊन चालावं लागतं.
करेक्ट.
आईला सांगावं लागतं की नाही अरे तुझी चूक नाहीये, ते तुमच्यामुळे काही झालेलं नाही, हा निसर्गतः झालेला प्रॉब्लेम आहे तुमच्या घरी. आणि वडिलांना सांगावं की तुम्ही फक्त पैसे दिले त्याचं तुमचं काम संपलं नाहीये. तुम्ही आई आणि वडील दोन्हीही इक्वली इम्पॉर्टंट आहात तुमच्या बेबीसाठी. तर हे सांगणं त्यांना खूप गरजेचं असतं. आणि त्यासाठी आम्ही काय करतो, आम्ही त्यांचं एक पिरियडिक सेशन घेतो, जेव्हा आम्ही त्यांना एकत्र बोलवतो महिन्यातून एकदा किंवा 2 महिन्यातून एकदा, आणि त्यांना एक ग्राफ टाईप दाखवतो की हा तुमचं बेबी या मागच्या वेळेला तुम्ही आला होता तेव्हा तुमचं बेबी आता या सिच्युएशन मध्ये होतं आणि आता त्याच्यामध्ये ही इम्प्रुव्हमेंट झाली आहे आणि पुढे आमचा असा गोल असणार आहे, तुमच्या आमच्याकडून काय अपेक्षा आहेत. त्यांना जेव्हा अशा पद्धतीने आम्ही इन्व्हॉल्व करून घेतो आमच्या थेरपीमध्ये, तेव्हा त्याचा फायदा त्यांनाही होतो आणि आम्हालाही होतो.
ग्रेट.
One two-way benefit actually. They also feel कि okay fine, we are not neglected, we are not left out, and we also get a response from them to father to mother, and it goes on hand to hand. Secondly, what happens in pediatric physiotherapy is that there is a lot of doctor shopping which happens.
Okay.
It's a young child and had a lot of problems. So somebody says, okay, you go to this doctor, he will cure your baby. You go to that doctor, he will cure your baby. You go to that baba and you will get some medicine, you get some blessing, something. You do this, you do that. And the parents, out of their frustration or out of their guilt, whatever you say, they try to approach everywhere, wherever possibly they could get help. And wherever they feel like, okay, fine, I'm going to get, my child is going to be fine. So we also try to convince them, and we try to let them know that, okay, physiotherapy is one thing, is needed for your child, and you have to continue that. Secondly, you have to accept the child as it is. Because acceptance is very important from the parent's side. If you are not going to accept the child, definitely you are going to neglect the child, and then the child's progress will be very poor.
Correct.
So we try to tell them, we try to convince them, we try to counsel them that, okay, fine, the child has a problem, we accept it and work on with it. There are many patients, there are many people around the world, out of their disability, out of their physical difficulty, they are working, they are doing the job, they are surviving in this world. Starting from Albert Einstein has been diagnosed with autism, right?
Okay.
So there are many people with the brain, but some other way they have difficulty in moving. They have some other way difficulty in communication with the world. But that doesn't mean that they are so-called normal. Okay. So we really take a lot of efforts to tell this to the parents, and we make them come again and again for session, and we try to make them clear the situation and the scenario that what exactly is going on with your child and what you are for your child and how you're going to work with the child. That is a very important thing we have to consider in the pediatric physiotherapy. Pediatric physiotherapy, as I said earlier, is a 3-way: a child, a patient, a child, a parent, and a therapist.
Correct.
So we have to take hand on hand, and we have to continue. That is what it is.
That's great. म्हणजे तुम्हाला एका मुलाला सांभाळताना तुम्हाला त्याच्या आई वडिलांना पण तुम्हाला काउन्सिल करायला लागतं, त्यांना सांगायला लागतं की दिस आर द थिंग्स विच यू हॅव टू टेक केअर, अँड नॉट माय सेल्फ. आय विल डू माय जॉब अकॉर्डिंग टू द वॉट आय हॅव बीन एक्सपिरियन्सिंग, बट द थिंग इज तुम्ही पण घरी जाऊन ते कंटिन्यू केलं पाहिजे, तुम्ही पण चाइल्डला थोडासा वेळ दिला पाहिजे. मग ह्या गोष्टींबद्दल तुमचं काय ओपिनियन आहे सर, की आजकालचे जे पॅरेंट्स असतात त्यांना कसं मग टाइम मॅनेजमेंट तुम्ही कसं सांगता, मग त्यांना ॲज अ पॅरेंटिंग म्हणून कसं तुमचे काय तुम्ही कसं गाईड करता पॅरेंट्सला?
सध्या काय झालं माहिती का, आमच्याकडे दोन स्टँडर्डच्या फॅमिलीज येतात ऍक्च्युअली.
ओके.
आय वर्क हिअर अराउंड रुरल एरिया. तिथं पॅरेंट्स शेतकरी आहेत आणि आई होममेकर आहे. फादर इज farmer, he is in the farm, he's going outside, and the mother is at home. And there is another strata which is in a city area where both parents are working,
Hmm.
and they have someone like grandmother or someone caretaker at home.
Hmm.
तर अशा सिच्युएशन मध्ये आम्हाला सर्वांना एकत्र बसवून सांगावं लागतं की तुमच्या बेबीची बेटरमेंट तेव्हाच होईल जेव्हा तुम्ही आम्हाला मदत करा.
करेक्ट.
आणि जसं मी आधी सांगितलं की त्यांच्याकडून ऍक्टिव्हिटी करून घेतल्या पाहिजे, तुम्ही त्यांना वेळ दिला पाहिजे, हे सगळं त्यांना आम्ही परत 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 सांगतो. कारण माणूस एक आळशी माणूस आहे, हा माणूस आहे अत्यंत आळशी प्राणी असं मी म्हणतो की तुम्ही जरा जरी बसलात की तुमचं शरीर लगेच तुम्हाला सोडायला तयार असतं की नाही आता ठीक आहे आराम करणार आहे म्हटलं की आरामच करणार आहे. ओके. आणि हे सगळ्यांच्या बाबतीत अगदी 100% होतच. इव्हन किड्स ऑल्सो समटाइम्स हेट टू डू ऍक्टिव्हिटी. ओके. अशा वेळेला पॅरेंट्सना हे सांगणं फार गरजेचं असतं की नाही, तुम्ही ऍक्टिव्हिटी करून घ्या, थोडं बाहेर घेऊन जावं बेबीला, एक्सपोज करा, त्याला वेगळ्या वेगळ्या गोष्टींचं नॉलेज द्या. फक्त टीव्ही आणि मोबाईललाच फक्त अडकून ठेवू नका. ओके फाईन, माय बेबी डझंट वर्क एनिथिंग, ही डझंट डू एनिथिंग, सो लेट मी मेक हिम सिट ऑन अ couch and let the movie start, let the cartoon go on, and I'll do my household chores, and meanwhile he will just sit and observe the TV. It is not going to work. You have to carry your child outside. You have to show him what do you mean by temple, what do you mean by river, what is sun, what is moon. Everything you have to expose for your child, and then only it is going to be helpful.
Correct. It's so nice. It's so great to hear from you that you're doing as a pediatric physiotherapist. Your role is not just for the child, but it's for a parents, child, and as you said, it's a triangle: parents, child, and a therapist. So both of all the three corners are sharpened.
Yes.
Then it will go ahead. Then only the goals will be met. That's really great. So just our last question for today, sir. What kind of advice do you give for the people who have entered into pediatric physiotherapy, or like for the recent graduates who have completed their graduation in pediatric physiotherapy, or for the people who are thinking of to go into pediatric physiotherapy but they have some hesitation to go into pediatric physiotherapy? So what kind of tips you will give for them?
My first tip is for the ones who want to enter in pediatric physiotherapy is that pediatric physiotherapist's role is not only bound to the girls. Boys, you also can do it.
Great. Yes.
Okay. The baby cries, baby does baby pees, baby poos, so it is not my cup of tea. No, it is not like that. If you have patience, you can work with the child and you can definitely make wonders with the child. Okay. So the ones who want to enter in pediatric physiotherapy, the suggestion for you is be patient, be observant, so that you will understand what is the problem and how you can work on it. And third thing is be analytical.
Okay.
Patience, observation, and analysis. If you have these three things with you, you can make wonders in pediatric physiotherapy.
Nice.
Absolutely. For the ones who are beginners and the ones who have opted pediatric physiotherapy, who want to opt for pediatric physiotherapy, I would say welcome with my heart. Because pediatric physiotherapy is the one thing which is going to give you not only just a satisfaction, but it is going to always challenge you till the edge for your creativity, your fun, as well as your knowledge refreshment.
Correct.
Okay, so it always continually goes on. Our patient is not going to be same for 1 month, after 6 months, and after 1 year. Okay, so you have to be always on your tip of the toes for your knowledge, your what exactly is the development is going to be, how exactly the child is supposed to be by the age of 8 months, 9 months, 6 months. Okay, so you have to be always tip top with your knowledge.
Correct.
Okay. आणि हे खूप मस्त चॅलेंजिंग असतं, तुम्हाला खूप मजा येते हे करताना. फक्त तुमच्याकडे पेशन्स हवाय, तुम्ही ऑब्झर्वंट असायला हवे, आणि तुमच्याकडे अॅनालिटिकल नॉलेज असायला हवं. हे का होतंय आणि मी काय केलं की त्याच्यात जास्त इम्प्रुव्हमेंट होईल.
हम्म.
एवढा जर तुम्ही विचार केलात ना तर तुम्ही डेफिनेटली पिडियाट्रिक फिजिओथेरपीमध्ये सर्व्हाइव्ह करू शकता. या व्यतिरिक्त जर तुम्हाला काही कोर्सेस करायचे असतील तर माझं एवढं सजेशन आहे की शॉर्ट टर्म एक अर्धा दिवसाचा किंवा 1 तासाचा किंवा ऑनलाईन कोर्स पिडियाट्रिक फिजिओथेरपीला चालत नाही.
Okay.
Actually should attend a proper course, okay, which is like session wise or a long duration type, where you can actually handle and observe the patients. Okay, that is definitely going to be helpful.
That's really
Otherwise, pediatric physiotherapy is absolutely fun enjoyment, and anyone can do it. Definitely, a boy, a girl, definitely can do it for sure.
That's great, sir. We can see yourself as an example. Being a boy, being a male, you are heading a department of pediatric physiotherapy, and so beautifully you have explained what is pediatric physiotherapy and how you deal with your parents and how you deal with kids and what kind of activities you suggest. It was a really beautiful talking to you, sir. I really appreciate giving you your valuable time to us. Thank you so much for joining us today, sir. Thanks a lot.
Thank you so much. Thanks a lot. Thanks for giving me an opportunity to be. Thank you.
Thank you, sir.